Neck and shoulder pain in the elderly often results from a combination of age-related changes, chronic conditions, and lifestyle factors. Below are the main causes. ***1. Degenerative diseases. Osteoarthritis. This is a degenerative condition of the joint cartilage due to aging. In the neck, the cervical vertebrae C1, C7 wear out the cartilage, leading to friction between the bones, causing pain, stiffness, and sometimes a crackling sound when turning the neck. In the shoulder, the joint that connects the humerus and shoulder blade is affected, limiting movements such as raising the arm or rotating the shoulder. For example, a 70-year-old person may feel shoulder pain when reaching for something above or neck pain when turning the head to look behind. Degenerative disc disease. The discs between the cervical vertebrae lose water and elasticity over time, reducing their ability to absorb force. This causes the vertebrae to rub against each other, causing neck pain or pain that radiates down the shoulder. If the disc bulges, it can press on a nerve, causing pain or numbness. For example, older adults may experience neck pain after sitting for long periods of time or numbness that radiates down the arm. Cervical spondylosis. This condition involves the formation of bone spurs or a collapsed disc, narrowing the spinal canal or nerve opening. This causes pain in the neck, shoulders, and sometimes affects the ability to grip. For example, a 65-year-old may have difficulty turning their neck to drive or feel pain radiating down their shoulders when carrying a heavy bag. 2. Muscle weakness and muscle imbalance. Sarcopenia. In older people, muscle mass naturally decreases due to aging, causing the muscles around the neck and shoulders to weaken. Weak muscles are not strong enough to support the joints, leading to muscle strain or pain when performing simple movements such as bending the head or raising the arms. For example, a sedentary person may feel shoulder fatigue after doing laundry or neck pain after reading for a long time. Poor posture. Older people often have a tendency to hunch over or bend their heads forward due to sitting for long periods of time or using their phones or computers in the wrong position. This posture strains the muscles in the neck and shoulders, causing chronic pain. For example, sitting for hours watching TV with your neck bent down can lead to persistent neck pain. 3. Injury and overuse. Past injuries. Previous injuries, such as falls, whiplash, or rotator cuff tears in the shoulder, can leave scar tissue or permanent damage. In older adults, poor healing can make these injuries more likely to recur as chronic pain. For example, a person who fell 10 years ago may experience shoulder pain in cold weather. Repetitive use. Repetitive activities such as heavy lifting, gardening, or even typing on a computer for long periods of time can cause tendinitis or muscle strain in the neck and shoulders. For example, an elderly person who frequently carries grandchildren may develop shoulder pain due to muscle strain. 4. Nerve compression. Herniated disc. A disc in the cervical spine can bulge or rupture, pressing on nearby nerves. This causes neck pain that radiates down the shoulder, arm, or even hand, along with numbness or weakness. For example, a 68-year-old person may experience numbness in their fingers when holding a glass of water due to a herniated cervical disc. Spinal stenosis. The spinal canal in the neck becomes narrowed due to bone spurs or degenerated discs, compressing the nerves or spinal cord. This causes pain in the neck, shoulders, and can reduce fine motor skills. For example, an older person may find it difficult to button a shirt due to weakness in the arms or shoulder pain when walking for long periods of time. 5. Inflammatory diseases. Rheumatoid arthritis. This is an autoimmune disease that causes inflammation of the joints, including the neck and shoulders. Arthritis causes swelling, warmth, pain, and stiffness, especially in the morning. In older people, the disease can severely limit mobility. For example, a 75-year-old may wake up with stiff, painful shoulders and need time to warm up. Polymyalgia rheumatica. This condition, common in people over 60, causes pain and stiffness in the shoulders, neck, and hips. The pain is often worse in the morning and improves with light activity. For example, an older person may experience severe shoulder pain when putting on a coat. 6. Lifestyle and environmental factors. Sedentary lifestyle. Lack of exercise weakens muscles and reduces joint flexibility, making the neck and shoulders more susceptible to pain when making sudden movements. For example, a person who sits watching TV all day may experience neck pain when standing up suddenly. Poor posture while working or sleeping. A pillow that is too high, a mattress that does not support the spine, or a desk that is not the right height can cause neck and shoulder strain. For example, sleeping with a pillow that is too hard can cause neck pain when you wake up. Stress. Stress causes the neck and shoulder muscles to tighten, leading to pain. In older adults, stress from worrying about health or finances can make this condition worse. For example, a person who is worried about illness may find their neck and shoulders tense all day. 7. Other diseases. Fibromyalgia. This condition causes pain throughout the body, including the neck and shoulders, along with fatigue and sensitivity to pressure. In older adults, the symptoms may be mistaken for arthritis. For example, a person may feel pain in the shoulder when lightly touched. Referred pain. Some conditions, such as heart attacks, pneumonia, or gallstones, can cause pain that radiates to the neck or shoulders. This should be taken seriously as it could be a sign of something more serious. For example, left shoulder pain with shortness of breath could be related to a heart problem. Osteoporosis. Weak bones from osteoporosis break easily, especially in the spine, leading to a hunched posture and neck and shoulder pain. For example, an elderly person with a hunched back may experience neck pain due to an abnormal curvature of the spine. In short, neck and shoulder pain in older adults is often the result of a combination of factors, from natural degeneration to lifestyle and systemic diseases. To relieve pain, maintain gentle exercise like yoga, walking, improve posture, use appropriate pillows and chairs, and see a doctor to treat underlying conditions. If you need further explanation of a specific cause or have questions about pain relief, let me know. I provided a list of rehabilitation exercises for neck and shoulder pain in the elderly in a previous response, but I will summarize and add some suitable exercises and reorganize them to be more concise, easy to understand, and focus on safe and effective exercises. These exercises help reduce pain, increase blood circulation, and improve flexibility and strength in the neck and shoulder muscles. Note: consult your doctor before practicing, especially if you have a medical condition, such as a herniated disc, arthritis, or old injury. 1. Neck and shoulder stretching exercises helps reduce stiffness and improve range of motion. A. Tilt your neck to the sides. Purpose: stretch neck muscles, reduce neck pain. How to do: sit up straight in your chair with your shoulders relaxed. Tilt your head to the right, ear toward shoulder. Do not lift shoulder. Hold for 15 to 20 seconds, breathing evenly, then switch sides. Repeat 3 to 4 times on each side. Note: do not lean too hard. Stop if it hurts. B. Shoulder stretch. Purpose: Stretch neck and shoulder muscles. Reduce tension. How to do. Sit up straight. Right hand holding the edge of the chair. Tilt your head to the left. Gently pull your head with your left hand to increase the stretch. Hold for 15 to 20 seconds. Switch sides. Repeat 3 times on each side. Note: pull gently to avoid pain. C. Bend your head forward. Purpose: stretch the muscles in the back of the neck. How to do. Sit up straight. Bow your head so that your chin is toward your chest. Hold for 15 to 20 seconds, breathing deeply. Repeat 3 to 5 times. Note: do not hunch your back. Keep your neck relaxed. 2. Strength training exercises strengthens muscles around the neck and shoulders to support joints and reduce pain. A. Nhenvai shoulder shrugs. Purpose: strengthens the trapezius and shoulder muscles. How to do. Sit or stand with arms relaxed. Shrug your shoulders up towards your ears. Hold for 2 to 3 seconds. Slowly lower your shoulders. Repeat 10 to 12 times. Note: do it slowly, not jerkily. B. Zoivai shoulder rolls. Purpose: increase shoulder flexibility. Improve circulation. How to do. Sit up straight. Rotate your shoulders in a circle from front to back 10 times. Change direction. Rotate from back to front 10 times. Note: keep the movement smooth. Seep isometric neck static resistance. Purpose: increase neck muscle strength without much movement. How to do. Place your hand on your forehead. Push your head forward but hold your hand back. Don't move your head. Hold for 5 to 7 seconds. Repeat in all directions: left, right, back. Do 3 times in each direction. Note: use light force only. 3. Exercises to improve posture. Reduces pressure on the neck and shoulders due to poor posture. A. Chest opener. Purpose: reduce hunchback, open shoulders. How to do. Stand up straight. Clasp your hands behind your back. Pull your arms down. Chest forward. Hold for 15 to 20 seconds. Repeat 3 to 4 times. Note: do not bend your back too much. B. Wall angels. Purpose: improve shoulder and back posture. How to do. Stand close to the wall. Back and head touching the wall. Bend your elbows into a W shape. Slide your arms up into a V, keeping your back against the wall. Repeat 8 to 10 times. Note: only work within your comfort zone. 4. Relaxation exercises reduces tension and muscle spasms. A. Deep breathing. Purpose: relax the neck and shoulder muscles. How to do. Sit comfortably. Inhale deeply through your nose for seconds. Exhale through your mouth 6 seconds. Repeat 5 to 8 times, relaxing your shoulders. Note: focus on your breathing. B. Shoulder and neck massage. Purpose: reduce muscle tension. Increase circulation. How to do. Use your right hand to massage your left shoulder and neck 1 to 2 minutes. Switch sides. Repeat. Note: hot oil may be used if permitted by your doctor. Note: when practicing warm-up, walk lightly or rotate your shoulders for 3-5 minutes before exercising. Frequency: 2 to 3 times day, 10 to 15 minutes each session. Painless. Stop immediately if the exercise causes pain or discomfort. Additional support: sleep with a low pillow 6 to 10 centimeters. Avoid high pillows. Adjust your seat so your back is straight and your shoulders are relaxed. Apply warm compresses for 10 to 15 minutes before exercise to relax muscles unless there's acute inflammation. See a doctor. If the pain is accompanied by numbness in the arms, muscle weakness, or pain radiating to the chest, get checked out immediately. It could be heart-related or nerve compression. If you need a video tutorial, more detailed description, of a specific exercise, or would like to add additional support measures like hot, cold compresses, let me know.